All right. Well, I think we're at the top of the hour, and I'm feeling rather pressured to get us started because we have quite the exciting program planned for you all today. And to launch us off, I think I really like to point to, why this discussion is important for each of us. My name is Sakar Bay. I am Program Director for WorkWell NYC. And I think what is most poignant is this quote from James Baldwin, who keeps repeating himself to me. It's sort of like nothing, not everything that is faced can be changed, but nothing can be changed until it is faced. And WorkWell NYC really aims to create change and to create progress within the city workplace and the city workforce in a variety of areas. And part of the series that we're conducting through the Project Build work is really about having these important conversations that matters most to about our wellness and holistic wellness, not just sort of your blood pressure or your blood sugar levels, but also how you feel, how your mental health, how you operate in your community, all of those things that provide fulfillment. And so we'll begin this discussion by first kind of giving you an overview. If you are a WorkWell NYC frequent flyer, I imagine you know this by heart, but for those who are new and joining us today, WorkWell NYC is the city's workplace wellness program established in 2016. We organize our work in 5 major program areas. Our Move More program really focuses on physical activity and staying active. Our Eat Well program is really all about nutrition and healthy eating. Our Take Action program is dedicated to really figuring out how we provide information and materials around primary care and prevention and getting ahead of your health. And our Be Well program, which is co-sponsored through Thrive NYC, is dedicated to mental health, well-being, and resilience. And one of our newest initiatives, Project Build, is really our programmatic focus on health equity and all those are things that drive health and get everyone to have a seat at the table. I say this early because it's really important. We want to make sure we connect with you and we keep you involved and engaged in not only discussions such as these, but any future discussions we might have, because health is holistic. We are on social media. You can email us. You can find us on the OLR landing page. But ultimately, if you want to stay up to date with what we're doing, we have a mailing list, and you can share that with your friends and colleagues, and you'll always know what's happening in the world of WorkWell NYC. Some very quick housekeeping before we get started. Your microphones have been muted. However, there will be an opportunity for question and answer to each of our panelists. Feel free to write your questions as they come up, or email us if they come to you after the program, and we'll see how we can get them answered. And this this webinar is being recorded today, so it will be posted to the WorkWell NYC Vimeo page, but it will be shared prior to this webinar with those who have registered today, as well as any additional reference materials our presenters have shared with us. So without further ado, I want to launch a poll. I want to understand who's in the room. So if you could answer this question for me, does race play a role in determining health outcomes in New York City? So we're just going to give everyone a couple of moments to respond. Right, so I think that's good there. So we have one person who said no. So yes, everyone, for the most part, seems to think that that is true. And I think that that is exactly what we intend to talk about today. So I'm happy we're all on the same page here. So I want to get into it and introduce today's panelists. Beginning with our first panelist, Priya Islam from OLR. She is our WorkWell program evaluator. As a native New Yorker, she has over a decade of personal experience and professional experience in the public healthcare system, and is an advocate working to working to advocate strongly on behalf of including the quality of life through health access, research, stigma reduction, and Priya identifies herself as really important in her frame of reference in which she'll be speaking today. First generation Muslim Bengali woman. She is a New Yorker, but not just a New Yorker, a millennial, a caregiver and patient advocate, and a consumer of the public health system. So welcome, Priya. Dr. Alexi Puran is a pediatric emergency medicine physician serving at, sorry, let me advance the slide, serving at New York City's Health and Hospitals Harlem since 2015. Dr. Puran is also an assistant professor of clinical pediatrics at Columbia University's Vagelos College of Physicians and Surgeons. Dr. Puran is passionate about improving the patient experience as well as the physician experience. He launched a patient family advisory council at New York City Health and Hospitals Harlem and served as the chair and the council. Dr. Puran also later held a position as a patient physician experience officer at New York City Health and Hospitals Harlem and has earned a degree as certified patient experience professional. Some of the identifiers for Dr. Puran is that he is a first generation West Indian immigrant, a physician, obviously, based on his bio, a patient advocate, and a patient also of the public health system. So thank you for joining us today. I really appreciate you joining us and sharing your insights from sort of the front line of the healthcare experience at Harlem Hospital. Next, we have Catherine Yaden, who has over 20 years of experience assisting individuals improving their lives through healthy lifestyle changes. She has a bachelor's in sociology, health, and Black studies from Lehman College and a master's in public administration and New York City urban government from Brooklyn College. She's a certified national diabetes prevention lifestyle coach and leads the WorkWell team in our field operations. Catherine is a wife, a sister, and a mother of young adults. She's also a baby boomer. Baby boomers, has Southern roots and a staunch advocate of the underserved population. So welcome, Catherine. And finally, we have Dr. Julian Watkins, who is a city medical specialist at the New York City Department of Health and Mental Hygiene. He is a clinical assistant to the Deputy Incident Commander and lead of the staff Immunization Justice Work Group, a group within the emergency response tasked with educating staff on the availability of COVID-19 vaccines and addressing vaccine hesitancy. He is also a Culture of Health leader. Culture of Health Leaders is a national leadership program supported by the Robert Wood Johnson Foundation. It fosters collaboration between people from all fields and professions that have an influence on people's health to build and thrive in their communities. Some of the identities that describe Dr. Watkins is that he is a multi-ethnic Caribbean Southerner. He is a member of the Lower East Side, queer, and an immunization advocate. And thank you so much and welcome and I really appreciate. And one thing I want to say, what is important about kind of defining identities with the presenters today is that obviously these are just a few of their identities. People are so multifaceted beyond the bubbles that I can put on the screen, but it helps inform the perspective that they might be speaking to and from and while we're here today. So thank you to all of our panelists for joining. And let's get started. And right before we enter the panel discussion, I just wanted to talk about equity and health equity. And I found this great kind of quote that I took from Understanding and Addressing Racial Disparities in Healthcare is that racial disparities in medical care should be understood within the context of racial inequities in social and societal institutions. This systematic discrimination is not the apparent behavior of a few, but is often supported by institutional policies and unconscious bias based on negative stereotypes. So when we talk about race, health, and you, it's not like we're pointing fingers at a particular thing or a particular person, but a system that is constructed in a way that produces outcomes that yield what we currently have. And with that frame, I think it's important to really take us through a very brief and unjust timeline of medical racism in the US to really to concretize and give us a foundation about where we're starting. Early upon slaves' first arrival to the new US, there was little, if any, medical attention provided to those slaves. And as we move through the timeline, one thing that I really want to really talk about is the Tuskegee experiment, something that I hear coming up time and time again. And it was about Black men participating in a syphilis study, and was not given the, was not given consent, not given the required medication to help improve their disease state. But I think what's powerful about the Tuskegee experiment is that it lasted for 40 years, and it created a very powerful narrative and interaction into the healthcare system for Black Americans. And we also hear the powerful story around Henrietta Lacks, whose cells were harvested in cervical cancer research without her consent. If we move up a little bit closer to modern day age, we also saw epidemics like the AIDS epidemic and their prevalence impacting communities of Black and Latinx populations more heavily than not in white communities. Even as recently as 2014, when we talk about water availability and access to services like in Flint, Michigan, and how that system was designed and who got access and who didn't. And right up until today in 2021, the COVID-19 vaccine, but also the prevalence of COVID in our communities continue to disproportionately impact communities of color. And we want to begin to pull the onion about what is the role of race and health and the intersectionalities between all of our communities and conversations. And when you really begin to kind of peel the onion, you think about New York City, we all live and work here. We see it happening in our day-to-day life. We have our health indicators, the BIPOC communities, Black people, Indigenous people of color are more likely to experience things like asthma, heart disease, respiratory issues, stroke, mortality, and maternal mortality and infant mortality is also disproportionately affected, as well as, as we talked about a little bit earlier, COVID-19. So the history is important because it emerges with us today, here and now. And in order to change what's happening here and now, we really have to understand the pathology of where we come from. And it all adds up, right? We have some things, there are things around experimentation, there are legislations around segregation, there's redlining, there's insufficient representation of communities of color in the healthcare system. We talk about deep cultural influences and their impact on how you interact or communities of colors interact into the healthcare system. We have misinformation or disinformation, and really all the things that come with scoping implicit bias and those factors that really kind of manifest in implicit biases. And you begin to understand why we have the system that we live in. What is the effect? So I got this quote and I realized I took this quote a while ago, but the attribution for who said it is under dispute, but it's not important. I think the message and the meaning is what I'd like to take away, is that every system is perfectly designed to get the results it gets. So we have a system that results disproportionate care in different communities, and it is designed this way, and there's no single attribution. But I want to turn it over now to our panelists to really kind of speak to our first question on the agenda, and I'd love for each of you to respond to this, is why is this conversation important to you today, here and now? So maybe we'll start off with Catherine. Why don't you talk to us about why this conversation is important to you?
Okay, good afternoon, everyone. So glad to be a part of this discussion. Just getting right to it, the conversation is extremely important to me because we have a future. There was a yesterday, there was a history. We have a system that is broken. It's coming to the forefront now, where ever so more now. It's so important to discuss disparities and all of the things that are happening, but particularly in healthcare, because we're faced with this pandemic now and what has to be done. So I'm really thinking about the future, what holds for tomorrow, what's important in the future. And for me, that's our next generation, the information that they will be receiving, the facts, the fiction, the things that were from the past, and how they move forward with the right information in order to get access to care properly, to understanding what they really need to be getting. And it's just ever so important. So that's why it's so important to me to keep this conversation, just not for today, but to keep it going so that our future understands it as well.
Thank you. Dr. Watkins, what brings you to you? Why is this discussion important to you?
For me, when I think about the discussion, it kind of boils down to, what we see. You posted the quote, these systems that are created, and I think it's understanding how this place was created and what the understanding was. And there was an understanding that in this country, certain people who look certain ways, who came from certain identities, mattered, and that they were valuable, and that everything was built to hold them up, and understanding that in that equation there were people who were deemed that didn't matter, people who were seen as less than human, people who were seen as undeserving. And that's a thing that was never really fully addressed in this country, and understanding that a lot of the stuff that we see is the manifestation of a lot of systems that were built with that kind of understanding. People try to fill in some of the words and try to claim some reckoning in time and say, well, this is when things change, this is when that changed. But understanding that if you don't really get to the heart of what was at the core of a system that was built like this in this way, then you can never really fix it. Because the Baldwin quote, the thing to be changed isn't like this system out there in the street or the hospitals. It's actually us. We have to face the thing inside of us and inside of the hearts of all of these people who are making up these human systems. And so for me, it's that important that the conversation looks deeper into the heart of the matter, because otherwise we're going to be stuck in this cycle for another 400 years.
And Priya, how about for you? Why is this conversation important to you, that it happens today, now?
Yeah, so thank you for the opportunity to be part of this panel. I feel like all the panelists are here today because of our, unique lived experiences in the healthcare system as folks from various marginalized communities and groups, and the impact that it's had on our lives. I personally have had countless experiences navigating the healthcare system, not only as a young professional, but also as a patient and an advocate for myself and my family. Like Sakara mentioned a few minutes ago, I identify as a first-generation Bengali Muslim woman, and typically, Bangladeshi folks in the United States have been traditionally part of lower income communities. That was certainly the case with my family. We were in the lowest income bracket. My mom was a homemaker. My dad was a taxi driver. Very traditional New York story. But we also had a unique experience of a rare genetic kidney disease that has had enormous impact on my, family. And this is a disease that has, that really leads to organ failure at a young age. And so, as you can imagine, that can lead to a slew of health problems. And that's something that I've experienced in my family. And because of that, I was consistently in and out of hospitals with my dad essentially throughout my childhood, and was able to witness firsthand the patient and the patient's family experience as someone that lives within the confines of the public insurance system. And as I grew up, I began to experience my own set of chronic health issues and mental health conditions, where I began to navigate the healthcare system for support, and found that it was incredibly difficult to obtain any kind of support, let alone reliable, culturally competent support. So that really impacted my perceptions of the system about who it's truly designed to keep healthy, and really fueled my fire and desire to change it for the better. So that's why I'm here today.
Oh, yes, yes. And finally, Dr. Purin, why don't you tell us a little bit about why this conversation is important to you?
Yesterday, we learned that over 1 million New Yorkers received the COVID vaccine. What we also learned was that the communities that needed the vaccine the most did not get it. The communities in Staten Island and in Manhattan had 10% of their residents receiving the vaccine, and other in the South Bronx and in Elmhurst and Corona and Queens, only 3% of individuals there got the COVID vaccine. This is the sad reality of health disparities. As an ER physician working since the beginning of the pandemic, along with my colleagues, I've seen the devastating effect and the emotional toll that it's had on our staff, our patients, and our families. It's the hardest thing to see when I tell a 10-year-old that they test positive for COVID, and to hear them start crying and saying, I don't want to die. I cannot allow us to continue the way we are and see our communities of color suffer disproportionately ever before. We must and we have to make a change. And I'm willing to put in the time, effort, and energy to make that change.
Oh, well, why don't we keep the ball rolling here? So we all understand just really how critical and vital this messaging is to really talk about how we fundamentally shift the systemic structure that we have here. So we don't have a child in the ER crying about not wanting to die, which is very real, very authentic. Speaking of children, I think part of the issue is that we really want to start off with is just sort of where this begins. And I'd like to take us back to your experience in growing up through and learning about healthcare and learning about, how you intersect and engage in that space. And maybe Kathy, why don't you talk to us a little bit about what you learned about healthcare and managing your own health as as an adolescent and growing into that experience.
Okay, it's very interesting because I thought about this. Being a baby boomer, growing up during that time, everything was secret. There were things that just were not talked about. If you were in an accident, you went to the hospital. But basically, if you were sick, as I know, my mom would just put her hand on my forehead, you have a temperature or not. So my feelings in terms of what I've learned about healthcare, it really wasn't too much. It was, you got sick, you got a script, you went to the doctor. However, it formed me in terms of wanting to know more as I got older. Because I realized that there was a disparity when I did start to go to the hospital for care and saw the different kinds of care that was given, the access to care. And that did shape my identity and my thinking around why am I not being treated the same way perhaps others were being treated that were in the same room. So in terms of just talking about what I learned growing up, I want to say my parents were from the South. And when someone passed away, it was like, basically, if you talk about diabetes, it was stated, oh, Aunt Erie Dice, which is a real aunt, she died from sugar. That wasn't understood that it was diabetes. And I really wish that there was more that would have been said to me, but I'm grateful to be at this point now, to be able to bring it to the forefront for myself and my children and anyone to be able to truly understand the healthcare setting.
I think that's such an important part about not talking about disease and keeping things quiet and keeping things hush and really not understanding what it means when you have that diagnosis and how do you take care of it. So I think that that's important to highlight, basically within communities of colors, do we talk about diseases and, do we talk about how they can be managed or maintained and what that pathway looks like. And so maybe we'll turn to Dr. Watkins and really talk about, your current experience in healthcare. What do you think has, played a role and how does identity play a role in that process,
For me, it definitely there's like the whole familial connection. Thinking about my father's mother, who died before I met her, but I still feel like I missed her my whole life. Who worked in Ohio, originally from deep South Mississippi, worked cleaning a big hospital, and would tell my dad about all of these experiences that she had cleaning up this major hospital center and the nasty things that people would say to her. But someone who could have been a nurse or a doctor under different circumstances, or like my maternal grandmother, immigrated from Central America to take care of people's kids, but is like has a deep love of people and is like a healer in her own sense, using like traditional like holistic methods, and thinking about that and just understanding that like the sacrifices that they made and my parents made and my people have made, and understanding that these doors that were made available for me, that I'm going to like go through them with my head held up, and I'm going to also take those people and their memory with me in all of these interactions and encounters, and to show other people who see me, who I see a bit of themselves reflected in me, that they also could do whatever they want, and they also deserve care, they deserve love and protection and healing, and to really just channel that through people. That kind of, that's the impetus that I bring to the work, and just to like to stand out against the systems that are so, cruel, and to act with love and really lead with that. Yeah.
And Dr. Purin, as an ER physician in Harlem Hospital, how do you experience identity and healthcare delivery? What does that look like on a day-to-day basis?
And so important that it's just not your race. There's other things that I take into concern in terms of my patients, their education level, their health literacy levels, their housing situation, food insecurity. These are all different things that are important and influence how I treat and manage my patients, because I want the best outcomes for all of them. And so I take into consideration, are they homeless? Are they living in a shelter? Do they have a stable home environment? Are they in school? These are the different things that make up your identity. And so you need to take those into consideration, and you can't treat everybody the same. It's not an equal playing field for everyone. And so I try my best to support my patients in what they need, and making sure that they can have the best outcomes as possible.
Do you think the system is currently structured in a way where you can do that effectively, efficiently?
I think it could be better. I think that I try my best and work my hardest to find a way of succeeding for my patients. It might not be the easiest. It might take a little bit longer, but it's possible. But I do think things can be better.
Well, Priya, maybe that might be a good segue to you as the current consumer on a panel, and working with a parent with a chronic condition. What is your experience in exchanging in the healthcare system, and how has this informed your relationship with healthcare and your I guess your larger community in some ways? What do you know now based on this experience, and what are you kind of challenging them to, if anything?
Yeah. Um, so I think first and foremost that what I've learned about healthcare growing up is like it's a waiting game. I've seen and experienced my father and also fellow community members wait excruciatingly long wait times to get appointments with specialists. So even when they're like seeking healthcare, it's been hard to even kind of get past that first barrier and make appointments. And I've seen him in the hospital while hospitalized and like receiving subpar care, or care that hasn't been as holistic as taking into consideration all the kind of aspects of his environment and his disease. And, you know, if you want to talk about health disparities and issues with the healthcare system, let me just say, like, my father has been on dialysis for the past 10 years, you know, a decade now at this point, and he's still waiting for a transplant. And, you know, knowing what we know about health disparities, you know, throughout the different communities, you can see how that's so, like, you know, that how much of an issue that is. So this was the context that I was raised in, and the experience has impacted me to the extent that I would say that, you know, my identity has shaped my experience in the healthcare system, but the healthcare system has also influenced my identity, because these are the sparks that have fueled my fire for advocacy, frustration with, you know, the inadequacies of my father's care, you know, naturally led me to advocate for him and speak up for the urgent care that he needs. But in addition, you know, I learned that healthcare support networks don't cater to all folks, like as we've been discussing. You know, I'll speak for myself, you know, particularly on the struggle of finding mental health support, a mental health counselor that is culturally competent and empathetic and responsive to systemic injustices in our society, and the impact that it has on a person's mental health and identity. I've personally experienced depression since I've been a teenager, and it took me years, I will say years, to get connected with a professional that even touched upon my needs. So like years of wading through a system that's frankly racially unbalanced in terms of, you know, providers, what providers look like and what patients who are seeking support look like. And frankly, you know, difficult to navigate in the first place. And once you get there, once you get to the appointment, it's, you know, that experience of feeling alienated by the folks who are assigned to treat me because I don't feel like they can even grasp the basics of like cultures like outside of theirs. And granted, you know, I used to think that this is just my bad luck, my personal experience, and I have to just keep trying and look for, you know, new providers and whatnot, but also consider like how counterintuitive it is for a person that is experiencing mental health issues. Like, what kind of capacity do they have to navigate this maze, this bureaucratic maze, to find, you know, healthcare support that suits their needs when the system is set up for folks who don't necessarily look or identify the same ways that you do. So I will say it has been a tremendous learning experience for me. And what I've really taken away from this is that in order to get anywhere near the standard of care that I feel that I and my family deserve, you know, I needed to advocate for myself. And I'd say that's the biggest like kind of learning experience for me, is that, you know, to continue on, like you have to know yourself and advocate for what you feel that you need and deserve.
Actually, that's a really powerful statement, you know, advocacy. I think the system is probably larger, the system is smaller than what the community demands from it. I'm talking about the healthcare community, anyone. Like there is a demand for access, for transparency, for culturally competent care, for all of these things. And the way it's, you know, it's structurally designed, it's sometimes there are in you know, incongruencies in that. And so I think that I'd like to fast forward us to kind of like this here and now, and kind of get our you know, our participants back on the line, and let's launch a poll. And I'd like to hear from you, because this is the soup du jour, the fire topic in the you know, biopic community. What's your take on the COVID vaccine? I've taken it, or once my group is called, I will take it, or I'm going to wait and see what happens, or nope, not for me. So no one can tell. No one's going to know. I don't know if you've seen that on TikTok. No one's going to know. But I'd like to hear what, you know, what your perspective is on the vaccine. And we'll get a few more responses. Right, so let's see what we have here. So for the most part, you know, there is a strong lean toward taking it, or if your category hasn't been called, you will take it once your cohort is called to task, which is very encouraging. However, it's not what I heard. So, Catherine, why don't you take us through the word on the street? What have you been hearing in your circles about the COVID vaccine?
Two-pronged, I want to say. First, when it, first came out, they were moving toward it. Constantly in my circle, I'm not taking that. I'm not doing that. That's not going to happen. There's been so much uncertainty. There's been so many things in the past that have happened. This is a conspiracy. They're going to be putting that in us, and the rest of us are going to die. If we don't get COVID, we're going to get this. But it seems like I've also heard a shift in my circle from individuals who have now taken it and seem to be okay. They're concerned about taking the second shot. But it's more that in the beginning, no way, forget it. I'm staying home with a mask. I'm going to social distance, not a problem, because this doesn't sound right. Too many manufacturers, too many variables, too many things happening. And it's just recently that one of our famous ball players, Hank Aaron, passed away. And there was a little bit of a talk about he had taken this vaccine. My daughter had told me about it, but then it shifted to, yes, he took the vaccine, but he didn't die from it. Just imagine if that rumor had in the African-American community had gone a little further, that it would have been more people shifting back to forget it, because they're looking at who's taking it. So it's two-pronged, more that on the street, it was in my circle, forget about it in the beginning. And it just, very transparent with myself in the beginning, no way, no thank you. But now my whole thing is I want to live. And I want to be able to empower others as well. And if this is something that is going to help me to live longer, it is just like I look at now, when growing up in the 60s, you had to take the MMR vaccine. Then when you went back to school, you had to take some other vaccines. It took years for those things to come into fruition of understanding. And this is going to be the same thing. But I think it's more now of, I'm willing for myself. Yes, I'm willing to do it, because if this is going to save my life or help me not have COVID at a higher, in terms of contagious, then it's something I'm going to do.
Well, this conversation is iterative in some ways, right? Today it's COVID, like it's something that globally everyone has been impacted from, by in some way. Yesterday it was something else. This is a continuous conversation about how these diseases, these viruses impact, communities of color disproportionately. So the voices or the narrative, it's hard to dispel a 40-year narrative of inappropriate treatment, even if you don't have the narrative right. I've heard lots of iterations of the Tuskegee study. So you might not even have the narrative right, but the what you take away is what's true, is that somehow someone's going to do something terrible to me as a result of my engagement in this. And so we duplicate, this kind of poor outcomes in this community. So I'd like to open up to anybody on the panel and sort of like, what do we say to try to really have a more transparent conversation to engage people in the right narratives around healthcare? So maybe we'll start off with Dr. Pearl. What do we talk about when somebody says, I don't trust the vaccine because the study did not involve enough people of color in it, and I don't know, what do we say with that? How do we respond to that kind of, discussion?
Definitely. The first thing is to acknowledge that it's okay to be afraid. It's okay to have fear. This is a vaccine that's come about in a couple months, but also it's been deemed to be safe by the FDA. The other thing is to listen to the questions, the concerns, the fears that my patients might have, and be able to answer that and explain to them if it's real or not real. And a lot of what I've been seeing and hearing, and it's been, with multiple patients, it's the same thing. Where are they getting this information from? And are they actually looking up or educating themselves and vetting this information? And are these trusted sources of information, and are they getting it from their doctors or their neighbor? Because when you're ill, you don't go to your neighbor, you go to your physician. And so I encourage them to ask those questions and be able to vet that information. And if it's wrong, stop it from continuing on and spreading, because information like that spreads so easily, and we don't need that in our community at all.
And Dr. Watkins, what about, I know in a lot of, we focus a lot on the, kind of defining the Black experience and kind of the disproportionate, just because that's been such a pillar in the evolution of medical mistreatment. But, New York City is very colorful in the communities that it possesses, and other immigrant populations and communities also are similarly impacted by COVID disproportionately. So when somebody might come to us and really talk about, how do we help heal? How do we move? How do we progress? But they say, you know what, I'm taking my ginger and my garlic and, and I'm eating right. Like, how do you combat that? Like, this is what they've been learned to do their entire life. How do you have that kind of discussion?
First, I apologize for the street noise. I think the conversation, there's multiple conversations happening at once. I think there's this historic discussion around hesitancy, as people are calling it, but a lot of times what people are doing, they're trying to flatten all of these communities into this one monolith, where it's like it's kind of absurd to think about people saying, well, what's the Black community doing? Like, what is the Black community? Like, it's ethnically diverse, it's culturally diverse, it's linguistically diverse. And I think we live multi-issue lives, and none of us have this just one thing that the Black community is upset about. There's a lot of Black folks living of all backgrounds who don't know about Tuskegee, but what they do know about is the HIV crisis. They do know about the other opiate epidemic where people were being pathologized. They do know about mass incarceration, police, education, all these things that are affecting folks. And it's a lot of flattening, and there's a lot of folks lying on us and saying, like, blaming us for the things that we're experiencing. So there's that's going on. And a lot of that, this negative narrative about us, it's some of it's internalized. It's making people kind of think, oh, well, they don't care and all of that stuff. But I think there's the other part of the conversation, which is what this vaccine represents and what it can mean for us. Vaccines have taken humanity out of really bad times. We've got rid of smallpox, we got rid of polio, we got rid of measles for the most part. Measles is nothing what it used to be. And that was the vaccine. And understanding that this current iteration of the vaccine is actually part of a long history of vaccines in humanity. We're just dealing with the most advanced, the most technologically advanced, like the newest types of vaccinations, and we're able to do it effectively, and we're able to do it safely, and we're able to mass produce it on a scale that we haven't been able to do before, because we haven't been in 2020, 2021 and had the technology that we have. And so when I have these conversations, it's acknowledging that first part and that flattening and this narrative that's made about us, and that we have to tell our own narratives, we have to speak up for ourselves and define ourselves for ourselves. But the other thing is looking at this vaccine, what it means historically, and what it means for us and our communities, and what it means for getting us out of this pandemic. And I think that the vaccine is one part, but we have to handle both of those things. We have to handle those narratives and the things that people think and say about us. And we have to talk about that history, and we have to talk about how to fix that, but also looking at this vaccine for the medical marvel that it is. And I think creating this is gonna, when we look back, when we get through this, we'll look back at this as something more significant than the moon landing that humanity has done, that we could end a pandemic that could go on for decades if we didn't have the technology that we have. So it's trying to expand the conversation and never flatten it down to like something that we can just put a bow on. It's complicating things a little bit more and really taking the time to dig in.
Yeah, I couldn't have said that better. I think part of what I've been hearing from each of you as I try to kind of squish this into kind of a soundbite, based on, kind of stemming from Catherine's discussion around beginning to talk about things, no longer keeping things quiet. And I think Dr. Watkins seconds, you're kind of reinforcing that, like change the narrative, create the story, break the pattern. And so I think one of the things I've heard about, how, communities of color can really improve just their engagement in their own health. And it is not only on the patient to do that, but this is the role that they can play, is to really to start to challenge. And I think Dr. Piran talked about that, like challenge who you're getting your information from, and is that a trusted source? And really start to advocate for yourself. And I think a lot of times, because we don't challenge sometimes, right? And in the systems that we're in, we believe sources that might not be trusted. It's difficult to advocate. And I think, Priya, you really talked about how, having had so many miles in kind of this healthcare experience, it's taught you to say, I have to speak up. And it can be very, I think this panel is very well immersed in the healthcare space. And so it might not be an accurate reflection of everyone, but imagine if you weren't, and how do you become a better advocate, a better patient advocate in that space, I think was really important. And so what I wanted to provide before we kind of, turn to our audience to see what questions they might have of you is an opportunity to say, if there was wisdom beyond these important points that I talked about that you really wanted to pass on about how we improve the space of communities of colors and improve their own health outcomes, like what's the wisdom that you want to offer? And I'll open up to anyone who wants to kind of weigh in.
I'll start just by saying that I think it's really, really so important to know your story. As me being a African-American woman with family that came from the South, migrated to the North, that's a great story. They migrated to the North. But when it came time, why did they come here? They came here for a better way of living. And in that, healthcare is a part of that, as well as all things.
Uh-oh, Catherine, I think your signal might be fading.
But, growing up in the 60s, it's just, can you hear me?
We'll circle back to Catherine's wisdom.
Okay.
Any articles of wisdom that we just want to offer, since we are our own, hand holders in this process. When I always look at that image of somebody climbing the ladder who looks behind and offers the hand to kind of lift somebody else up behind them. What's the wisdom here in this process?
I would definitely say that don't feel like you can have a role or that you won't be able to make a change, because each and every person, and if we all work together, we're going to be able to change the way how things are. In a personal level, I think, we can recognize our own implicit biases. And also, as we, in our work everyday lives, as we seek to, institute new policies and programs, we look to see if it's going to make a difference in health disparities. Everything that we do, we should reflect back, and is it making a difference in decreasing the disparities that we're seeing? And then finally, knowing that all of us together, we have to work together. If only a certain segment of us, if the physicians and the nurses and the patients are not joining us, we're never going to be able to move forward. This has to be a process that we all work together, and it's possible. And I know we can do it, and we have to do it for our future and for our country.
All right, well, let's see if there are any questions from any of our audience as we begin to kind of count back on our time here together today. Victoria?
Yeah, so one of the questions that has come up is there is a significant difficulty for people of color to get appointments. So is that something that any of our panelists would maybe like to discuss, the difficulty in getting appointments, or ways to navigate technology around getting appointments?
I could speak to the appointment issue. I mean, it just kind of highlights what marginalization really looks like in real life, where certain groups and communities aren't, or people with certain needs or certain barriers in their life haven't been necessarily as centered in different aspects of the response. And even when it comes to vaccine distribution, where like there is a lot of difficulty with access for people who are living with disabilities, for people of color, for older folks, for people who don't have the material resources. So there's that level of having to respond in an emergency response and responding quickly, but not being able to meet the needs of the people. But I think what really is important is that it's only because of so much advocacy, years and years of advocacy, and folks like us on the panel who understand the real value of equity, that there are folks who are in these positions of equity. You know, where in the health department, we have a deputy commissioner who's from equity background. We recently got a new chief medical officer, you know, who comes from an equity background. So it's understanding the value of folks, and folks who understand the world and understand these other backgrounds, to really have them in positions of power, to have influence on these programs, so that we actually can do that work of working with community organizations and really focusing on how we can get the access to people who need it and who've been most affected. So that, and then understanding that it is very frustrating, and that there's people whose job every day, hundreds, dozens of people every day in the health department and across the city, folks in other agencies as well, who are volunteering to make sure that this program is equitable and better. So it's a work in progress, but there is also the fact that the supply does not meet the demand, which is also just make, you know, a limited resource in the United States. You know, we've seen how that goes over and over again.
I will also say, from kind of like a patient and patient advocate perspective, that, you know, this issue with finding appointments for folks of color is not limited to the COVID vaccine. It really exists in kind of all avenues of the healthcare system and spectrum. And so while you're continuing kind of the journey and the fight to get yourself an appointment, whatever context that may be, I just wanted to say that, like, the struggle and the search for quality healthcare shouldn't be detrimental to your health. And even though sometimes it may feel like such a long and arduous road, and you might feel like you're losing energy because you keep calling and you can't make appointments, or you can't get through the different systems. But while you're continuing that battle, you need to do what you can to keep yourself and your family as healthy as possible. So I guess my message is, like, stay resilient, because, you know, just because we are speaking about the issue and we're aware that it exists, it's not going to change overnight, because that's the thing with systemic issues. It's a system we have to bring down, and it starts with transparency. It starts with having these conversations, but it doesn't end there, because, you know, you still might be a person without an appointment. So while you're continuing that, remember to do what you can to keep yourself, you know, resilient and healthy, as best as you can, while you're trying to get your quality health care.
Maybe we have time for one additional question. I know there are a few in the hopper here. What do you think?
So one more question is, what would you say is the greatest problem in achieving equity in the COVID vaccine for minorities? And this is another question was reflected in this, in saying that if COVID was a Black and brown only issue, would it have received the same publicity? So I think those two questions kind of go hand in hand, and I will pass it over to the panelists.
I could say that there are a lot of issues that have been relegated to Black and brown communities that don't get a lot of attention. And I think that's what a lot of the uprising over the summer was about. And so I have my doubts living in this country that was kind of founded, you know, as a white supremacist, capitalist, patriarchal society, that a lot of issues probably wouldn't be elevated. But I think it's about elevating those issues and talking about HIV, talking about mass incarceration, talking about COVID and who died from it and the vaccine distribution, understanding that there are issues of Black Lives Matter within all of these things, and Brown Lives Matter, and lives that are not white and straight and able-bodied matter too. And I think it's getting to the heart for me. I mean, I guess the message is it's getting to the heart of what those things are in these hierarchies and really addressing that on a fundamental level in all of the work that we do and how we live our lives. Like, how do these hierarchies play out, and really speaking to that and understanding that we have to change something because these conventional ways that we've operated as a society have not worked for a very long time and will not work for these unconventional times. So it's just that understanding that we are facing big things, but mass movements of folks with a love ethic have changed the world before, and we can do it again.
I think that's such an important part as we think about what it will take to change the system, whether you're old or young, whether you're a patient or provider, whether you're a member of the BIPOC community or not. I think it is going to take everybody to have a seat at this table to change the system that is designed, that currently gets the outcomes that we get. And if we do the things that we've always done, we'll get the answers we've always gotten. And so when I think about communities of color, it's like, if you do the thing you always did, you'll always get the same result. So how about we try something else? It couldn't hurt, right? And I think that starts here and now with having these conversations, changing these narratives, thinking about where and how you can get support. And what is interesting about our population, the city population, is that we are all insured. We have access to benefits, we have access to healthcare, and thinking about how we leverage those to the fullest extent, to really think about primary and preventive care. I think in the Office of Labor Relations, we see that there is just a profound concentration in emergency and urgent care, and really focusing on how we skew away from that and how we start finding those trusted providers, like Priya said. It doesn't detrimentally impact our healthcare to find those providers to kind of begin to change the narrative about healthcare. I would like to extend a profound thank you. I feel like this conversation needs an additional 6 hours to really comb through and tease through a lot of the questions and conversations, but this is the beginning, and it is the intent of Work Well NYC to keep bringing these issues to the surface, bringing these discussions to the surface, and we hope that you can now in turn have conversations with your communities, your families, your trusted circles about these discussions, and really be really imperative about what it means and what it will take and what you need to do now in this moment to help change this conversation. And with that, we have run out of time, but before we go, I want to quickly take us through some resources that I'd like to point you to. Please get tested and get vaccinated. If there was anything that I could say to you, but knowing what I know, if these are not available to you right now for a variety of reasons, continue to stay home if you feel sick, continue washing your hands, wearing your mask, and staying socially distant. This is the most profound piece of prolific advice that I have in this moment based on, the advice of our panelists. There are resources available if you want more information around each of those areas that will be provided to you after this webinar. Primary care, it's really hard to treat the disease at the end stage, whether it's hypertension, diabetes, asthma, really start thinking about what your circles are, start asking around, there are many now technological innovations that are hosting physicians and providers that are rooted in culturally competent care and reflect the population of the audience that they serve. So I implore you to start doing some digging around, because there's an app for that, and there are providers available. So get engaged and log on to the health benefits page. That's where you can source what providers are covered under the health benefits plan that you belong to with the city. And finally, living in a pandemic is mentally frustrating at best for the healthiest of us. And if you are struggling and if you are suffering in any way, we want to implore you to seek care and to connect you with either the city's EAP, which is specifically for the city population, but New York City Well, that is for anyone who lives in New York City, to provide somebody who can help pull you through, because isolation, loneliness, mistrust, fear, loss, it begins to add up and can ultimately impact your health and be deleterious and far longer than this vaccine shortage will take us through. And also our Be Well programs is really offered to city employees to really think about the day-to-day maintenance and resilience of your mental health. So I encourage you to use those links and to log in and to contact us if you have any questions. Finally, WorkWell is really compiling a digital resource centers. Our presenters have shared some really impactful resources that we have loaded into a digital center, and you can go there and find a variety of things about EEO, COVID-19, how to talk to your children, what books to read, a variety of things. And itself also, it's community-based, so you also have the opportunity to add resources that you think are important and compelling in this conversation. So final word is that we are always listening to you. So if there is something you want to see, want to know, want to do, we have our ear to it and we want to provide. And so please tell us in the evaluations, tell us in the inbox, tell us in the review of this, what you think and what you want to know more of. And once again, thank you to each of our panelists for joining us today. It was a pleasure and an honor.